My name's Monik Vasant. I'm an aesthetic dental surgeon from the UK. I practice in London and Manchester. My specific area of interest is minimally invasive aesthetic dentistry. I use a variety of techniques, including short-term orthodontics and adhesive dentistry, to get the results that my patients are happy with. I'd like to discuss with you today some cases where I've used the MIRIS2 material alongside other techniques to get good results. Just to remind you, the MIRIS2 material consists of 8 shades of dentine with a single hue, a single opacity, but varying different levels of chroma. We have 5 enamel shades: white bleach, white regular, neutral translucent, and ivory regular. We have tints and effects: white, white opaque, gold, and blue. And I've used a variety of these different materials during the presentation I'm going to show you today. This lady came to see me. Her main issue was the appearance of the anterior teeth. Clearly they were very prominent, but in addition she had this large, ugly veneer over here. In addition, there was also a very large composite over here on the other central incisor. There was also asymmetry in terms of the gingival levels and a space distal to the upper right one. Orthodontic treatment was undertaken by myself, and after a few months of retroclining the teeth and retracting them into the arch form, we then decided to carry out a little bit of soft tissue work to recontour the soft tissue around the upper right one, and then replace the veneer on the upper right one with a feldspathic porcelain veneer. On the upper left one, we decided to do a direct composite using MIRIS2. Almost a full veneer restoration in the end. I'd like to show you this case because it's interesting, because here we've merged feldspathic porcelain with direct composite with very minimal difference in the aesthetic appearance. We have a look here, and although there's a minor difference on day one, it's pretty good. So it just shows the sort of luster we can achieve with MIRIS2. Here again, same case, and we can see overall a successful result. Here's another case. This gentleman came in with a very similar problem. He had crowding of the teeth, upper and lower. In addition, there was considerable amount of labial erosion of the central incisors, along with some incisal edge wear to the upper front 4 teeth. I carried out some orthodontic work to align them, and then we got to this stage. So clearly we could see that the incisors were clearly worn. There was a lot of erosion labially. So we decided to carry out 4 direct veneer restorations using the MIRIS2 material. So here we decided to, before this, do a little bit of bleaching just to even out the shades a little bit, and then using a combination of the white bleach enamel along with the S1 and S2 dentine shades, along with a little bit of incisal edge opalescent shade using the blue effect, we've got a very nice result that the patient was very happy with. This gentleman came to see me. His main issue was the gaps between his anterior teeth, and you can see they were quite prominent. The gentleman was going to university, so he was only a young man, and he didn't want orthodontic treatment. Finances were limited at the time, so we decided to go with direct composite. We decided in this instance to start again with a little bit of tooth whitening just to even out any shade discrepancies, and then finished up using just 2 shades, white bleach and S1 dentine, white bleach enamel, to get a very nice result. We've recontoured the morphology ever so slightly, and you can see these are just partial restorations, yet they disappear into the tooth due to the optical properties of MIRIS2. Here's a close-up, and we see we have a very nice integration of the restorations. Here's another diastema case. This lady, we can see very evident opalescence around these teeth, which she wasn't really keen on. In addition, she had the midline diastema. Again, this lady was talked through different options, including orthodontic work, and it was decided to just proceed using direct composite using MIRIS2. So here, again, we chose a lighter shade of dentine, along with a lighter shade, quite an opalescent shade of enamel, and we ended up with this result. However, we just padded out the palatal aspect of the incisal edge just slightly, as the lady wanted to just soften the opalescence a little bit. But again, very natural result, very conservative, very little, no preparation required, and overall a very happy patient. Another case. This lady came to see me about this old composite on the incisal edge here that had fractured, but it was quite discolored, quite yellow. This lady had quite characteristic banding, white banding on aspects of the teeth. So we decided to go for more of a natural shade, so we chose the dentine shade. In this case, it was an S3 with little areas of S4. On top of that, we decided to use a neutral regular enamel shade, but I supplemented this with some effects just below the enamel layer using some of the white, milky white effect. And just to give a subtle little bit of characterization to the tooth to match the one opposite. In addition, we closed up the diastema a little bit, and although the tooth may look slightly wider, we tried to detract people's attention from that by just repositioning the mesial line angle ever so slightly and opening the embrasure so that people didn't really notice the tooth was slightly wider. Here's another case. This young lady came to see us, and her main issue was the gap between the central incisors. She had these retained deciduous teeth, and this case on the surface looked like quite a complicated case due to the size of the space. However, after carrying out some measurements, we realized that we could achieve a good aesthetic result using MIRIS Direct. Again, this time we left the deciduous lateral incisors because they're going to be replaced with dental implants, but we've closed the diastema quite nicely. If we look in close detail, we have some mild opalescence here. We have more of a higher chroma in this area. So we've built that into the restoration, maybe using an S2 and S3 near the gingival areas, with going up to a lighter shade and then using more of an opalescent enamel shade over the top. And we have a nice result. Peg lateral case. This lady came in with the peg lateral. Again, we want to try and choose a conservative option. With a porcelain veneer, maybe matching the restoration might be difficult with it just being a single restoration. However, with direct composite like MIRIS, we can achieve so much and try and copy all the nice effects in the adjacent teeth. And again, gone for more of a natural shade, high chroma near the neck with some opalescence near the incisal edge. This is the blue effect you see here with a white regular shade this time over the top. As it's a young patient, we still have more of a white tone to the enamel. This is an interesting case. This came in with very severe tooth wear. The lady was getting married, a lot of erosion anteriorly, mainly localized to the anterior teeth. And in this case, we decided, because time was in factor, we decided to go with the DAL, direct composite technique, where basically we open up the occlusion on the anterior teeth using direct composite, and then over a period of 3 to 6 months, the occlusion settles via a combination of mandibular repositioning, posterior over-eruption, and anterior intrusion. You can see if we'd have gone for an indirect restoration in this instance, it wouldn't really have been very successful given we didn't have much retention and much tooth structure to stick to. Here, direct composite works really well because it's resilient, and a material like MIRIS is pretty strong, great optical properties, and we can see this picture taken 12 months after the original picture shows that the restoration's still intact, still in good health, and aesthetically sound, and the occlusion has settled. This case here, we have failing composites from many years ago with some caries underneath. We decided in this instance, again, direct composite was perfect restoration for this instance. So again, using the MIRIS material posteriorly works fabulously. We can get really good aesthetic results. So here we have replaced the restorations. We've gone with a much higher chroma dentine shade, something like an S4, maybe even an S5 in some areas, and then replaced the enamel with a regular white bleach, and then placed some Fisher stain using the gold and also a brown Fisher stain that is available. And on the cusp ridges, we have placed some of the white effect just to highlight those ridges really nicely and get a good aesthetic result. Here, another posterior case. And I'll talk you through this one step by step. So this lady came to see us, wanted to replace these amalgam restorations. So we first isolate under rubber down, then replace the restorations and bond. Then we place a white opaque, because if we see the case, the base of the cavity is extremely dark, and we want to try and block that out so it doesn't influence the overall shade of the restoration too much. So we block that out with the white opaque effect shade, acting like a flowable base. Follow that up then with the dentine layer. Here we used a lighter dentine layer as the patient had done some tooth whitening. We decided to go for an S3 and then finish that up with some enamel layer in terms of white bleach, along with some staining effects. And this is post-op. A nice natural looking result. Again, we've used the gold and some brown effect in the fissures with the white highlights. This gentleman came to see me, some erosion on the incisors, so on the upper left one, along with a mild crowding of especially the lateral incisors. So we carried out some very basic orthodontic treatment just to get some minor alignment, and then placed MIRIS2 as a labial veneer over the upper left one to try and replicate the upper right one. Here again, patient, an older patient, so we've decided to go for an S4, S5 dentine shade in some areas where it's needed, and then a natural regular and ivory regular enamel shade over the top. See the erosion here and some toothbrush wear, and we've repaired that. This again showing that. And a very natural looking result for someone of this gentleman's age. A young patient, this lady came to see me with a fractured incisal edge. Quite bad trauma, and she was very disturbed at the time. We calmed the lady down and then looked to replace this because half the stress of the situation is caused by the injury itself, but also the psychological impact of having broken a central incisor. So in these sort of patients, it's important we repair this quickly and in a pain-free way. So direct composite is the perfect solution here. We've tried to copy some of the opalescence that we've got there. The lady didn't want to copy the white effect there, but everything else was copied. And we've got a nice aesthetic result, again using more opalescent types of enamel, supplemented with some blue effect to get that result. This case, lady came to see me. Orthodontic problem, again, crowding, discoloration, and worn incisors. And in this instance, the starting treatment was some orthodontic work that I carried out over 12 months, just to align the anterior teeth. Followed that up with some standard home tooth whitening with night guards, and then finished that off with MIRIS2 direct restorations to the upper central incisors and the upper right too. And we've got a fabulous result. And you can see here we even use elements of gold effect near the incisal edge to get a really nice result. And this we've used shades like the white bleach and the S1 in terms of the dentine, supplemented with the opalescent blue and the gold. This case, again, another gentleman about to get married, at the time limited finance because weddings are expensive, and the chap came to see me and his issue was the anterior teeth. There was gaps, quite extreme wear to them. He wasn't too concerned about the high smile line there and the large amounts of gingival display. His main issue was the appearance of the teeth. So we decided to carry out some bleaching to start with, and then followed that up with direct composite to the upper anterior 6 teeth. Using, again, a dial approach, so we opened up the occlusion on the anterior teeth. Here we just used 3 shades. We used the white bleach, the S1, along with the opalescent blue effect. And we have a very nice end result here that restores the patient's confidence and gets him smiling again. Thank you for watching. Happy layering.